This video will demonstrate the BVM ventilation of an apneic adult patient evaluation. Students will voice everything they are assessing, and their evaluator may clarify treatments during the assessment. You will be able to review your equipment before beginning the evaluation.
Okay, I want to take appropriate PPE precautions. I want to get the level of consciousness of my patient. Sir, can you hear me, sir?
No response.
Okay, I'm going to do a sternal rub.
No response.
No response, so I'm going to call for ALS and rescue. Now I want to look, listen, and feel for no more than 10 seconds.
The patient is unresponsive, apneic, and has a weak pulse of 60.
Okay, I'm going to go ahead and open my patient's airway. Do I see anything in my airway?
The mouth is full of secretions and vomitus.
Okay, now I want to take my suction unit. I'm going to grab my rigid catheter. I'm going to turn my suction unit on. I'm going to place my catheter in as far as I can see, not closing the port. Once I'm inside, I'm going to close my port and I'm going to suction in a circular motion on the way out. No more than 15 seconds. Is my airway clear?
The mouth and oral pharynx are clear.
Okay, at this time I'm going to place an OPA, appropriate size from the corner of the mouth to the earlobe. Insert it backwards, rotate it at 180 degrees. Does my patient accept it?
There is no gag reflex present, and the patient accepts the airway adjunct.
Okay, good. This time I'm going to bag my patient. I'm going to turn my bottle on. I'm going to hook up my tubing to my oxygen port. I'm going to turn it to 15 liters a minute. Now I'm going to ventilate my patient once every 6 seconds. 1001, 1002, 1003, 1004, 1005, 1006. I'm going to ventilate 10 times a minute, once every 6 seconds. And I'm going to do that for about 2 minutes. After my 2 minutes, I'm going to go ahead and reassess for a pulse and breathing. I'm going to look, listen, and feel. I'm still apneic and I still have a weak pulse of 60. I'm going to go ahead and continue to bag. I'm going to bag again 10 times a minute, one every 6 seconds. And I'm going to look for equal rise and fall. I'm going to feel for good bag compliance and condensation of my mask.
In this evaluation, the critical criteria are: after suctioning the patient, failure to initiate ventilations within 30 seconds or interrupts ventilations for greater than 30 seconds at any time. Failure to take or verbalize appropriate PPE precautions. Failure to suction away before ventilating the patient. Suctions the patient for an excessive and prolonged time. Failure to check responsiveness, then check breathing and pulse simultaneously for no more than 10 seconds. Failure to voice and ultimately provide high flow oxygen of at least 85%. Failure to ventilate the patient at a rate of 10 to 12 per minute, one ventilation every 5 to 6 seconds. Failure to provide adequate volumes per breath, maximum of only 2 errors per minute permissible. Insertion or use of any adjunct in a manner dangerous to the patient. Failure to manage the patient as a competent EMT, exhibits unacceptable effects with the patient or other personnel, and uses or orders a dangerous or inappropriate intervention.